Today's notes are over diseases and disorders of the digestive system, which means we're at the end of our unit. Normally we'd have a test, but since this is sort of an unusual time, we're going to do some things different, and I will explain those later in Google Classroom, what I'm expecting from you on that. But diseases and disorders, always at the end of the unit. First thing, cancers of digestive organs. There are a lot of cancers because obviously all these organs are exposed to lots of things on a regular basis. So every day you are eating and drinking, breathing, all those kind of things, taking in stuff, different toxins you're exposed to, even just regular foods that can cause things like pancreatic cancer, liver cancer. But don't worry too much. Your body has the ability to usually defend itself against most of those things, but they do happen and are difficult to usually observe simply from the fact that we don't see them until they're at the point that they become basically metastatic. Aphasia. Aphasia is a disorder that's usually also seen more as a side effect for some things because inability to swallow. So maybe you took a medication, that medication caused aphasia for a period of time where you could not swallow. Diseases like the mumps, things like that where it affects the salivary glands, makes it difficult to swallow. Those kinds of things can lead to aphasia. Cholecystitis, that is an inflammation of the gallbladder, usually caused by gallstones. Gallstones are created when the bile salts basically crystallize inside the gallbladder because they've been sitting there for sort of too long, and once they form as a little small crystal, they form bigger and bigger crystals. To get rid of them, doctors either going to use a sonics, where they try to break it up with an ultrasound, or they try to use a chemical to dissolve it away, or worst case, they go in and have to remove the gallbladder. And in that case, you'll survive, but that means you're going to have to adjust your diet because you no longer can eat those fatty foods and things like that you need lots of bile for in order to break it down. Cirrhosis. Cirrhosis means a hardening or a scarring. In this case, the hardening or scarring of the liver caused by damage to the liver over time from utilizing or being exposed to multiple different things like toxins. As those cells get overused, they basically stop functioning and they become scar tissue. And the more and more you get, the less and less your liver can actually function and your body can function normally. Diverticulitis. Diverticulitis, like many other parts of the intestinal tract, can become inflamed as an inflammation of the large intestines. Those ridges and folds along the walls are great for moving things through, but sometimes stuff gets stuck in them, seeds, other types of foods. And they'll start to basically rot or irritate or damage those linings. So one of the best ways to deal with that is, doctors will tell you, is to eat fiber. Fiber acts like a natural scrubbing agent and scrubs out that area to clean out those kinds of areas, cleans out those kinds of ridges. And that's going to keep it from having problems down the road. Dysentery. If you played Oregon Trail or you talked about Oregon Trail in history class, you know a lot of people die from dysentery, which is because people die from dehydration due to dysentery. Dysentery is going to be a severe infection, primarily the small intestines, from microorganisms that you've gotten through the water, primarily bacteria and protozoans. It can also be viral as well. People drink water that's been infected by animal feces or human feces or fecal material, and thus that bacteria gets in where it's not supposed to. Your body has to try to get rid of it. In this case, causes severe irritation to the point that our body tries to expel as much as possible. You lose too much water. You can't keep water in because you're basically trying to expel it out, and so eventually you're going to dehydrate. Enteritis. In this case, also an inflammation of the small intestines. Microorganisms can cause it. It's primarily caused by injury. People swallowed something they weren't supposed to. People suffer from like pica or even like coins and other objects, glass. And it basically lacerates and damages the walls. And all of a sudden now they can be attacked by the enzymes in there and by the microorganisms, causing severe infection and damage to the point that if you're not careful, they may have to go in and remove whole sections of the small intestine to get rid of it. Hemorrhoids are something you hear about in commercials because they have all kinds of medications for it. It's an enlargement of veins in the anal cavity that eventually extend outward or can to the surface. The problem is those enlarged blood vessels now can become irritated, disturbed, and eventually can be ruptured, cause it to bleed out from that area. So they use an astringent agent, something that's going to basically shrink up those veins, or you have to sit on like small pillows in order to protect yourself from causing damage. A hernia. Hernias in general are any part of a body that's been put in the wrong position. It's been moved and pushed in the wrong area. A Heinel hernia is a very specific form, where your stomach is shoved up through the hole in the diaphragm that the esophagus passes through. And every time you breathe, that diaphragm pushes down on the stomach, causing severe acid reflux for a prolonged period of time. Other types of hernias, the ones we think of with our body, something like your small intestine gets shoved into a small rip in the muscle wall, and every time it pushes the muscle, it basically clamps down upon it. A peptic ulcer. These are ulcers. Ulcers are basically sores. In this case, either in the stomach or in the intestines. And they're caused when your own gastric juices, your own enzymes that break down your digestive food, start to break down your walls of your either stomach or intestine and put holes in there. If you're a normal, healthy, younger person, not a big deal. As you get older, your body's ability to repair itself or repair these sores becomes basically problematic. If you're a much older person, you may have a problem where it could eat through there, eat into a blood vessel, and all of a sudden you bleed out internally because your body's not able to repair it fast enough. Again, a normal, healthy person, not a big issue. One of the big diseases, though, is hepatitis. Hepatitis is any inflammation of the liver and caused by an infection usually. Now, the key concept here is there's multiple forms of it. There's lots of them. And what we've done medically is we've given them letter designations. So I'm going to give you the first few of them that are very important. Hepatitis A, not heard about as much, but usually only in cases where food has been eaten that's been contaminated. Because you get it through eating contaminated food, contaminated by human feces. So human waste or sewage gets into the ocean, somebody eats food like shellfish that had eaten that contaminated feces, and now all of a sudden you get sick from it and you get a mild short disease. It usually goes away after a week or two, sometimes longer. More common ones people hear about are the STD versions, typically virally caused. So in this case, this is a virally caused one. It's hepatitis B. It is caused through a very particular version of the virus. If you get it, there's also ways to now, you see commercials for dealing with trying to take it down with antiviral medication, not really cure it, but take it down. Hepatitis C, though, is the more common form, even though it is also a virally caused one. They both are ones that can cause long-lasting, permanent damage to the liver if not treated. You're not really curing them in most cases. Most times you're just trying to treat the symptoms and get the viral load down. Hepatitis D is one that most people don't worry about because unless you have hepatitis B, it's not really a big deal. Your body's immune system can fight it off. You get it through infected different sources, whether it be people, animals, whatever. So it's usually very mild, but it's only affecting you if you already have damage to the liver. This becomes a problem as a secondary infection. And then hepatitis E. Hepatitis E comes through drinking contaminated water. So there was a leak maybe in the sewer system and contaminated sewage gets into your drinking water, and all of a sudden people get sick from it. People usually recover from it. They can die. It could cause permanent damage to the liver, but generally it's not as dangerous as ones that cause more lifelong issues with viral versions. But it is a situation where it can be dealt with, and it happens more often from breakdowns in our common way our water is dealt with. And that is the end of our unit.